Oregon Health Authority. Today, we are providing an update on the very latest developments in the COVID-19 pandemic here in Oregon. Joining us today are Dr. Dean Seidlinger, Health Officer and State Epidemiologist at the Oregon Health Authority, Dr. Dana Harganani, Chief Medical Officer for Oregon Health Authority, Dr. Peter Graven, Director of OHSU's Office of Advanced Analytics, and Colt Gill, Director of the Oregon Department of Education.
Okay, no.
Please mute your microphone if you could. And this is an opportunity for members of the media to ask questions and hear from our experts. The public is encouraged to ask questions during our Facebook Live events. And we do want to point out to our media friends that Zoom does not allow recording. So many of you have already asked for permission to record. We will send out a link of the recording after this meeting. So let's get things started. Dr. Seidlinger.
Thank you, Erica. I'm Dr. Dean Seidlinger, Health Officer and State Epidemiologist at the Oregon Health Authority. Once again, COVID-19 has regrouped and is on the march across Oregon. Today, the highly contagious Omicron variant is driving an alarming spike in COVID-19 infections, virus-related hospitalizations, and test positivity. We have seen this across our recent days. Today, OHA will report 10,451 new daily cases of COVID-19, a sobering reminder of the formidable challenge that lies ahead for all of us. This is not the way any of us wanted to begin the new year. We are all tired of taking steps to fight this virus. We're anxious as we hear from more of our family and loved ones who are sick with or were exposed to COVID-19. While the data is stark and discouraging, we all have tools to help protect ourselves, loved ones, and our neighbors: vaccinations and masks. As of yesterday, the 7-day average for new cases over the last month increased 373%. The Oregon Health Authority has recorded new pandemic highs in daily cases every day this week. More than 9,700 cases were reported over the extended New Year's holiday weekend, another pandemic high. That percent positivity crested at a stupefyingly high 23.3% on Wednesday and hovers at an astonishing high 7-day rate of almost 20%. COVID-19 related hospitalizations, which had stabilized over the past 6 weeks, are once again climbing, raising the ominous possibility that our hospitals, still feeling the effects of the Delta surge, may once again get swamped by another wave of illness. The COVID-19 weekly report recorded 290 hospitalizations, a 57% increase from the prior week. That followed a 6-month low in hospitalizations reported that previous week. Still, our hospitals are struggling to maintain the fragile balance between providing care for people who are ill with the virus and others needing medical care. We have announced new measures to assist our hospitals in managing the anticipated surge. They include deploying 500 National Guard members to support frontline medical workers, providing a crisis of care tool to hospitals to help clinicians make the difficult decision if there's not enough staff or equipment to provide life-saving care to every patient. Creating a surge tool up to 1,000 additional clinicians to support nurse crisis response teams across the healthcare system. And we're extending clinical staffing for hospitals, long-term care facilities, and other congregate settings. We must ensure that staffed hospital beds are ready and available to everyone who needs them. While a person who gets sick with Omicron may be less likely to be hospitalized than if they were sick with the Delta variant, it will sicken many more people at a much faster pace, thus increasing the number of people hospitalized. It will disrupt lives and livelihoods. Unchecked, it will overburden our already exhausted healthcare workers and oversaturate our healthcare system. Many more people, excuse me, I'm hearing feedback if everyone could mute. Many more people will be sick or will need to help take care of a sick loved one or will be asked to stay home because of an exposure to someone with COVID. Many people will have to miss work, and we will see disruptions in the services that we're used to. The good news is that we are far better equipped to fight the virus in 2022 than we were even in 2021. We have expanded our vaccine capacity. Several mass vaccination sites are open. Opportunities for boosters are widely available. We have significantly ramped up our testing capacity. This week, the state began receiving some of the recently ordered 6 million COVID-19 antigen rapid test kits, which will yield 12 million tests. The tests will produce results in just 15 minutes. These testing kits will be offered to people around the state in some of the communities most impacted by COVID-19, and they'll be free of charge, so that these individuals can determine at home if they are carrying the virus and take steps to prevent its spread, such as isolating at home and keeping their distance from others, and wearing a mask when they do leave their home after 5 days. We have adopted new policies to make our classrooms safer for teachers, students, and staff. Director Gill will talk more about those changes. We moved quickly to adopt the new recommendation from the Centers for Disease Control and Prevention regarding isolation and quarantine to reflect what is known about the potential impacts of the Omicron variant. The change is based on research that transmission occurs early during the illness, generally 1 to 2 days before symptom onset until 2 to 3 days afterwards. The CDC guidance recommends that a person who is positive should isolate for 5 days, and if they are without symptoms or symptoms are improving and their fever is gone, that they can leave isolation if they continue to wear a mask for 5 days to reduce the risk of infecting others. For unvaccinated people or for people who have not yet received booster shots, the guidance calls for staying home after an exposure for a period of 5 days, followed by strict mask use for 5 more days. This new guidance will shorten the period of time that people are asked to stay home with minimal increased risk in spreading the virus. Anyone who has been exposed to the virus is urged to get tested 5 days afterward. People showing symptoms should limit contact with others until a negative test confirms no infection. We are also making changes to case investigation and contact tracing. Earlier in the pandemic, case investigators and contact tracers worked tirelessly to make individual calls to provide isolation and quarantine guidance and to support people who have tested positive or been exposed to someone who tested positive for COVID-19. During the current surge, case investigation and contact tracing cannot effectively slow the spread of the disease. Rather than every person with COVID-19, OHA will create a COVID-19 case support hotline for people who have tested positive, including with at-home tests, and those who have been exposed to someone with COVID-19. So instead of individual calls going out, individuals will have a number where they can call. Public health can then focus on higher risk settings to reduce the spread and prevent the most serious disease. Callers can get information on isolation and quarantine, receive assistance with a mobile-friendly survey for those who have tested positive, and learn about available support resources. This opt-in approach will help reach more people who need additional services or higher levels of support. It will also help address the burden on Oregon's public health system by triaging calls that might normally go to local public health authorities. A reminder that 211 remains the best source for general COVID-19 questions, information about testing, and access to vaccination appointments. We can all do our part to blunt this newest surge by getting vaccinated. And then, if you're 5 months from your second Pfizer shot, 6 months from your second Moderna shot, or 2 months after your Johnson & Johnson vaccine, get a booster shot. The existing data and the established science show that if you are fully vaccinated and have received a booster shot, you are protected from getting COVID-19 and from being hospitalized. If you are unvaccinated, consider this a red alert. You are in greater danger of getting the virus and passing along to others than at any time during this pandemic. If you are ill with COVID-19 and have not yet been vaccinated, you cannot count on the acquired immunity to stave off the Omicron variant. This virus will find you. The strong immune response you get from being fully vaccinated, followed by a booster shot, is the most effective protection against all variants of COVID-19, including the Omicron variant. More than 3 million Oregonians have received at least one dose of a COVID-19 vaccine. Nearly 1.2 million have received a booster shot. Thank you to everyone who has made the choice to protect themselves, their families, their neighbors, and our communities. thank you to all who have taken the time to get vaccinated and then get boosted. Last month, Governor Brown set a goal to get 1 million additional boosters by the end of January. Unfortunately, due to inclement weather and the holidays, traffic at the high volume sites has lagged. But despite those challenges, almost 250,000 Oregonians have gotten a booster shot since the end of last month. Even if we don't reach our goal, every booster, every vaccination offers someone more protection and helps protect their family and their loved ones. I acknowledge that this dire outlook is the last thing you want to hear as we toll another calendar year in the pandemic. We're all tired of the virus, but the virus is not tired of us. Many of us are anxious and scared. We want to get to a time where COVID-19 isn't weighing on us. We can blunt this latest surge by getting vaccinated and then boosted when eligible, by wearing masks indoors and outdoors in crowded places, and by keeping our gatherings small. Stay home if you're sick or know you were exposed to COVID-19. And thank you to all who are taking these important steps to protect themselves and their loved ones. Your collective efforts have saved thousands of lives across Oregon. To find out where you can get a COVID-19 vaccine, go to getvaccinated.oregon.gov. Get ready, get vaccinated, and get boosted. And with that, I'll turn things over to Dr. Peter Graven for an update on the latest COVID-19 modeling.
Thanks, Dr. Seidlinger. I'm here to talk to you about the data and the projection model that we use to look at Omicron's path. The short story is the model does show a steep increase in hospitalizations. It's driven by the infections and cases we are seeing now. The peak in hospitalizations is expected at the end of January at about 1,652 patients in Oregon being in a hospital bed for COVID. That is 30% higher than the peak of Delta. We are seeing these levels in states on the East Coast and know they're coming to Oregon. The reality is it's spreading amongst vaccinated people. People who have done the right thing by getting vaccinated are still, by and large, protected from severe illness. However, they aren't nearly as protected from being infected. That means that vaccinated people can have a significant effect right now in reducing the spread and conserving hospital capacity by really sticking to the public health measures that you've heard about. The model, we do know more about the virus, and it is creating some milder infection in some people. My model does account for that. And it accounts for the fact that Omicron variant is still driving hospitalizations, but it tends to be less severe than previous virus variants. That doesn't help it with the kind of all-at-once impact on hospital capacity that we're going to see here, and hopefully prevent. My model does account for the fact that the average length of stay in the hospital tends to be shorter, with less need for care in our intensive care units, less ventilators, and hopefully less death as well. Unfortunately, data from the East Coast show that the sheer number of infections will lead to a corresponding increase in all types of care, including ICU. So while the ICU rate may be a little bit lower than before, we are seeing strong increases in the number of ICU beds for COVID. There is some hope. Data is showing that Oregonians are already taking the measures that we need to prevent the spread of the virus. It's going to be imperative over the next few weeks that we stick to wearing masks and avoid indoor gatherings. At this point, you can really assume, it's probably safe to assume that you are positive when you're thinking about who to be with. Anything we can do to flatten the spread of the infection over a longer period of time will free up healthcare resources for Oregonians who need care in the hospital. That includes COVID-19, but also includes people who need the hospital for heart attacks, motor vehicle accidents, strokes, and everything else. I'll be available to take questions afterwards, but these are kind of the main points I wanted to share with you today. Turn it over to Colt Gill, I believe.
Yes, yeah, thank you, Dr. Graven. I appreciate it. Good morning, everyone. We set a North Star for this school year to safely hold school in person all day, every school day for every student all year long. This remains our highest priority. We believe most children learn better when they're taught in person. We know that children and families rely on schools to provide a caring and safe environment. and many need access to a solid breakfast and warm lunch that's provided at school. For parents and families, consistency matters. And for many, school is a way to ensure that parents can go to work and support their family. 4 months into this school year, in-person learning is facing its greatest obstacles. The Omicron variant is surging and will continue to infect thousands more people in Oregon over the next few weeks, as we've just heard. And COVID fatigue has set in. We are tired of having our lives and our routines interrupted or impacted by masks, physical distancing, vaccinations, and all the other protocols that have worked to keep our numbers low to date. Like every other workforce, healthcare, the airline industry, professional sports, etc., schools have been and will continue to be impacted by this Omicron surge. Our educators, aides, office staff, bus drivers, cooks, servers, custodians, school leaders have shown amazing grit throughout the pandemic, and they have kept the promise of in-person learning this year. They have worked well beyond their normal hours. They have worked outside their normal roles. They have tested students and one another, and they have provided comfort and care. They have been succeeding, and it's taking a toll on them as they live and move through the pandemic just like all the other families here in Oregon, trying to make it all work. They will keep this going because they know how important in-person learning is. We have seen some schools move temporarily to short-term distance learning, and we will see that happen in more schools over the next few weeks. The primary reason is that there are too many staff impacted by COVID-19 to be able to operate schools in person. They're either ill or quarantined. This will cause challenges for everyone in that school community. With short notice, families will need to figure out childcare and revisit online classes. Some will lose time from work. Today's announcement about shortened quarantines will help reduce the impact and hopefully prevent more closures like we've seen. There are two other things we can do to reduce the possibility of temporarily moving to short-term distance learning for individual schools around Oregon. The first happens at schools. We must set our COVID fatigue aside and reteach, reestablish, and re-emphasize all the layered mitigation protocols that we know work. Get vaccinated and boosted to avoid quarantines. Wear properly fitting face masks and to help limit spread. Maintain physical distancing, provide opportunity for frequent hand washing, and even through the winter months, maintain good airflow and ventilation. Even with high community spread, consistently implementing these practices keeps COVID-19 from spreading in structured school environments. We've proven this, but we have to commit to it to ensure that this works with the incredibly contagious Omicron variant. Second, we need support of the broader community here in Oregon. You can control community spread as well and reduce the number of cases that get introduced into our schools. First, get up to date on your vaccinations. Get the booster. Wear a mask whenever you are around people outside your household. There are things you can do to help keep our school doors open for all of our children. Look, we hear a lot about the Omicron variant causing less severe cases of COVID-19. I am not a medical doctor, but I have a couple of thoughts about this. While the severity may be less for most people, especially for those up to date with all of their vaccinations, the community-wide impacts are as significant as ever. Flights are being canceled. Restaurants are temporarily closing some evenings because they don't have staff to operate. Games are being rescheduled, and some of our schools have had to move online temporarily. None of this is related to any mandate. It's happening because too many people are falling ill to keep operations going. Let's come together to keep people healthy, if only to keep our schools operating in person for our children. And two, our schools mirror our communities. We serve everyone in our public schools. That means that we have children, teens, and adult staff that are more vulnerable to the impacts of COVID-19 than the general community. While most who contract Omicron variant may do just fine after a few days or weeks of illness, and some may not even have symptoms at all. Others, though, may be hospitalized, impacted for months, or even die. Wearing a mask, getting a shot, to me, those seem like small prices to pay for sparing a vulnerable neighbor, friend, or family member from a severe case of COVID-19. Thank you for doing all that you can to help us reach our North Star for our kids this year. Let's keep our school doors open. And now we can take questions.
Great, thank you so much, Director Gill. All right, and hopefully you all heard at the very beginning of this to mute your microphone. Thank you for those that did. It was a little rough at the start there. Amy Green, we're going to start with you. Thank you for raising your hand. Again, please raise your hand if you'd like to ask a question, and we'll put you in the queue. Go ahead, Amy.
Thank you. I think this is for Director Gill. Can you explain more the strategy with schools? It seems inevitable that virtually every child and employee in schools will be exposed. Perhaps the only protection from actually being infected will be the vaccines. But what is the strategy? Is it to just continue on with school, understanding that everyone will be exposed, but you'll just temporarily close down when staffing gets really low and you can't carry on? Do you have any alternative plans? I mean, is ODE offering any direction about, well, if your staffing is really low, I mean, let's just understand that this is going to burn through the school, and we will try other strategies like combining classrooms and grades, moving around staff, moving around students to make sure that they get some in-person time with whoever the teacher is.
Yeah, thank you. Good question. And I will provide an answer, and Dr. Seidlinger may also want to chime in. For us, again, critically important, our North Star is to have our schools open for in-person instruction all school year this year. We do know that COVID-19 with the Omicron variant is going to have broad community spread. And Dr. Graven shared some of those numbers in his comments earlier. We may have many staff members who are exposed to COVID-19. There's a difference between being exposed to COVID-19 in a structured setting like a school, where everyone in that setting is properly wearing face coverings, where they're adhering to some physical distancing properties, where they have ventilation and filters in place in the school setting, than there is when a person is exposed in the community or in their home. And those other protocols are not in place. The chances of exposure leading to contracting COVID-19 are far greater outside a structured school setting than they are inside a structured school setting. So we do believe that most schools in Oregon will be able to maintain operations and stay open. We have strong test to stay protocols. We have test kits available to all of our school districts who sign up for the program. This means that when a student or a staff member is exposed at the school level and they're not showing symptoms, that they can take a test and continue to stay in the school community while they may be quarantining in the general community while they're at home. All of those things can help our schools stay open and operating in person. We also have a number of what we call continuity of instruction supports for local school districts. We have data dashboards for them, decision guides, and planning guides for operating short-term distance learning and moving right back into in-person instruction as quickly as possible. The other ideas that you put forward to combine classrooms, to have teachers cover for other teachers who are absent, those have been happening since the beginning of the school year. Again, our educators, our educational assistants, and others have been doing amazing work to keep schools operating every single school day. We have principals and superintendents across the state who are driving school buses on a daily basis, who are operating in school kitchens and substituting for teachers on a regular basis. All of this to ensure that our schools stay open for our students. We'll see that continue. And if we can maintain these protocols for reducing the spread of COVID-19 in schools, most schools will be able to make it through this surge as well.
I'm sorry, just one little follow-up on that. So I'm hearing that you think that most students and staff don't have to become infected. They don't have to be exposed. That's kind of a surprising thought to me, hearing so many experts on the national level say that you've got to wear an N95 if you don't want to be exposed. I'm looking at, how most people wear masks. Most of them are still wearing cloth ones, at least in the schools, I believe. Do you think it's possible that most kids won't be exposed?
Yeah, again, so I'll have Dr. Seidlinger talk about masks and about what exposure leads to, but I'm not saying that people, students and staff members won't be exposed. So many people will be exposed in the general community, oftentimes without those safety protocols in place, and many people will be exposed in schools where those safety protocols are in place. When you're exposed in school and all of those safety protocols are in place, it's much less likely to lead to contraction of the disease. And we also have on-site testing so people can find out right away if they have contracted COVID-19, and we can have the test to stay option so that when those tests come back negative, staff members and students can continue to attend school. And I would look to Dr. Seidlinger on masks and other exposure information.
Thank you, Director Gill. When it comes to masks, I think we have to remember a couple critical factors. It's the quality of the mask, the fit of the mask, and wearing it consistently. So while a respirator type mask, an N95, KN95, or KF94 can offer superior protection, in the general community, that level of protection may not always be needed, but a well-fitting mask, cloth mask of 2 or more layers, or a disposable surgical mask in many settings can offer similar levels of protection. In addition, there are things we can all do to make our masks fit better to protect ourselves and those around us. Wearing a cloth mask over a disposable mask helps to improve the fit and closes the gaps around our cheeks. That mask should be above our nose, below our chin, and snugly across our cheeks. 2 or more layers of a quality mask are going to offer some protection. So, we need, whether it's the children in our schools, the adults, the staff, and the teachers, to wear masks that they're going to be able to wear all day, that provide them the most protection. And that, on top of the filtration, air circulation improvements that have been put in place, the robust testing strategies to screen individuals who may be asymptomatic, or to identify individuals early, and to follow individuals after they've been potentially exposed to reduce the risk of spread, all add to the safety of schools. So schools will be impacted, as we're already hearing, by illnesses. But these measures taken together, and the actions of all of us out in the community to reduce the spread of COVID-19, will make a difference and will keep more children in chairs, at desks, in front of talented teachers, getting the learning they so richly deserve.
Great, thank you, Dr. Seidlinger. Our next question is from OPB. Christian, go ahead.
Yeah, thanks very much for taking my call. So I was out and about yesterday talking to a lot of people who were sitting in their cars waiting to get tested. A lot of them had, sore throats and they were sick. And the question that kept coming across was, who should get tested? Should people who are sick get tested, or who should not get tested? And this is, while they're waiting and all these tests are not here, I know you've got more coming, but it seems to me there's a bottleneck there that somebody might say, well, this is who should get tested and this is who should not get tested.
Thank you, Christian. This is Dean Seidlinger. I'll take that one. I think, as we've seen by the increase in testing numbers over the last few days and the increase in the percent of those tests coming back positive, there are not enough tests here in Oregon, and it's the same problem in many other states. Right now, I would still say that if you're sick with symptoms of COVID-19 and you can get tested, I would recommend you get tested. This can help you make decisions about how long you need to stay home, limiting your contact with those around you to prevent the spread, and notifying those household members of your infection so that they can take steps to protect themselves and those around you. In addition, if you know that you've been exposed to someone with COVID-19, getting a test around day 5 will help determine whether you got sick from that exposure and if it's okay for you to go back to work or school or out in the community, or if you need to take some additional steps. While the increase in testing has been slow and frustrating across Oregon, we know that additional tests are arriving. There are many community-based drive-up or walk-up sites. There are still appointments at some healthcare providers and pharmacies, so those are much harder to get. At-home tests are starting to arrive more commonly in retail settings, but still frustratingly hard to get. And we have this week started to receive some at-home tests that will be distributed to individuals in communities most impacted. In addition, we expect tests from the federal government to start arriving to some of those same community health centers, food banks, and others, and to individuals on their own in the coming weeks. So for now, I would say if you have symptoms of COVID-19, I would recommend getting a test. If you've been exposed to someone, I would also recommend getting a test. Seek out one of these community-based settings without appointments if there are no appointments available, or if you have at-home testing that can serve as a good way for you to get the information you need to make decisions about staying home and notifying those around you. But right now, unfortunately, we don't have the amount of tests we need, so there are some longer lines and patience is required.
Just a quick follow-up. So do you think there will be enough tests for these, people who are asymptomatic after the 5 days and people who are sick within maybe a week, 2 weeks, 3 weeks, or we're going to have to wait for all those 5 weeks of trucks to arrive in Wilsonville until we've got it all? And even then, will we have enough for somebody to say, hey, go online in the morning, find something by noon and be able to be done with it?
Yeah, I think I wish I could say that they were all going to be here in the coming week, but I think it'll be several weeks as these tests come in, but it will get easier because there are multiple parts of the system that are getting more tests. We know that the manufacturers are shipping out more tests across the general system, that the order that Oregon placed at the end of last month is being filled and started to come in this week, that there should be some additional federal distribution of tests, and that we're adding more community testing collection events along with our mass vaccination events so that we can get those tests into the laboratory to get tested. It will be a slow process, and it will unfortunately be several weeks before that system catches up.
Thanks.
Okay, our next question comes from Genevieve with K2. Go ahead, Genevieve.
Thanks, Erica. And I have 2 questions. The first one for Dr. Seidlinger again, and it goes off what we were just talking about. So hopefully a pretty seamless transition here. But when it comes to testing, as you had mentioned, the reality is tests are impossible to find. If you found out today that you were exposed and you waited a day or two to find a test, you're not going to be able to find a test at a testing site for several days later, which means if you have to assume you're positive, you're stuck in your house, not able to work, not able to do whatever it is you need to do. I mean, why aren't there enough tests? This is the 3rd calendar year that we've been in this pandemic. It's 2022. Shouldn't testing be more easily accessible in Oregon now? Why are we still struggling to find tests? Where is the bottleneck there?
Thank you, Genevieve. I wish there were additional tests. And yes, it is frustrating, not just for individuals, but for me in public health, for our healthcare providers to not have more tests. There certainly is an issue with at-home tests being a really important tool that have been slow to arrive in the United States, have been slow to ramp up in production, but we're seeing significant gains in those tests, and we'll see more of those available throughout our communities. Right now, if you're sick with symptoms of COVID-19 and you can't find a test, staying home while you have symptoms until you recover is important because you very well may have Omicron. You may have something else, but either way, you want to prevent giving that to others. If you have underlying conditions that make you more susceptible to being hospitalized for COVID, you're older, you have a condition that puts you at risk, and you can't find a test, contact your healthcare provider about getting tested in case you can get tested early, and we can link you to preventive treatments to prevent hospitalizations as antiviral pills hopefully start to arrive in Oregon in the coming days. But yes, this is maddeningly frustrating. There's not the supply of tests that all of us would like, but we are starting to see changes in that supply chain, and I think we will see that in the coming weeks.
Do you think this is a problem from the federal level? I mean, we see other countries who have way better access to tests, and the tests are exponentially cheaper than they are here in the United States, like over in Europe. So is this a problem that stems from the federal level, that we just didn't prioritize testing enough from the beginning in the US?
I think across the country throughout this pandemic, we've had issues with accessing testing. That issue is not unique to our country. Several other countries have gone in with adopting antigen testing and home-based testing much sooner than we have. That's not a strategy we've had broadly across this country, but I think we're starting to see changes as the disease becomes much more prevalent. As individuals who get the disease are less likely to be hospitalized, these at-home tests, I think, will become a more important tool as we move towards being able to live with the virus and minimize the risk to others. But yes, we have been slow to adopt this process, and I think it's not something that's unique to Oregon.
Thank you. I appreciate that. And the last question I had was for Gail, talking about schools. Can you go more into the obstacles that schools are facing to stay open? I mean, are we out of substitutes? Do we not have enough testing in place? Why is it to the point now that schools are having to temporarily close?
Yeah, I
You
think
explained it, honey.
two things, Genevieve. So we have, from the beginning of the school year, been challenged to maintain enough staffing in our schools. So we are short on substitute teachers. We also are short some critical staff positions in schools across the state of Oregon. We've experienced shortages with our bus drivers, with our nutrition services staff, with specific classroom teacher assignments in special education and science and mathematics and a few others. Between those shortages and having a lack of substitutes to come in and support those positions, and then now the Omicron variant making many more people in our communities ill or quarantining more people, it has pushed some school districts or some schools past that limit where they can safely operate in person. So we do have many schools, and teachers will tell you these stories in middle schools and high schools where instead of having a period to prepare and plan their lessons and do grading and things like that, many teachers are teaching every single period every day to substitute for other teachers in the building who are out ill. Elementary teachers are sometimes seeing more students in their classroom. If a school, for example, has 3 third-grade classrooms and a teacher is out, that third classroom might split up and be spread out among the other 2 classrooms. So people are working very hard to make it all work, but you do hit a limit at some point where if you have enough staff that are out ill, you can't operate in person. So they will pull back and for a week or so move into online learning if that's the case.
Thank you, Colt. Appreciate that.
Thank you, Genevieve. Okay, our next question is from Angelina at KVEL. Go ahead.
Thank you, Erica. This question is for Dr. Seidlinger. Going forward, if the surge gets too big for hospitals to handle, will doctors be forced to make decisions on who gets care and who does not in terms of non-urgent care?
Thank you, Angelina, for that question. We certainly do see an incredible fast and steep rise in cases, and the hospitalization numbers are starting to go up. Hospitals are doing many things right now to move staff around and to continue to provide the quality care that all of us deserve. As I mentioned, the governor has authorized the deployment of National Guard again to help support our healthcare system, and we still have contracted staff in place who will help support those systems and many other things in place. But there could come a time when care may need to be rationed based on the resources. So with that, I'd like to turn it over to Dr. Dana Harganani, who can talk more about the process we've gone through in case that day comes.
Thank you, Dr. Seidlinger, and for the question. Our doctors, nurses, and other frontline healthcare workers have been working incredibly hard throughout this pandemic, and they are exhausted while now facing the rising surge of Omicron, as has been discussed here. This morning, OHA released an interim crisis care tool that can assist hospitals at this difficult time and in the event there are scarce critical care resources. We want to help hospitals navigate some difficult times ahead with the potential there are not enough critical care resources to go around. We will continue to support hospitals, as Dr. Dean Seidlinger has mentioned, the staffing support, Oregon National Guard, and other resources. But if Oregon's hospitals have a number of patients present for critical care resources that exceeds capacity, and there's no option to transfer patients to other critical care facilities, they may need to use these types of tools. The tool we provided can help hospitals make difficult decisions in a way that is fair, non-discriminatory, and focused on health equity.
Thank you. Thank you for the question. Our next question comes from Rachel Monahan with Willamette Week. Go ahead, Rachel.
So just for everyone on the call, first off, to follow up on crisis care standards, are those available for us to look at somewhere?
We can get those to you, Rachel. This is Dr. Harganani. They are on our website now, and we can follow up with you for sure, everyone.
Great. And so I think I have a question for Peter Graven. If I'm remembering correctly, the number of Oregonians who have had COVID at this point, it's around 10%. What's your estimate for what percentage of Oregonians will, or projection for how many Oregonians will get COVID during this wave? And maybe for you or others at OHA, what do you believe the undercount is right now on the number of Oregonians who have gotten COVID this week? Yesterday on a call with the press, the Tri-County health officers said that they expected that the reason that high vaccination rate areas were reporting the largest number of cases had to do with who was accessing care. So a few questions in there.
Rachel, I can start off your question about the number infected. Actually, you know, the way we think about infections is not just those who have tested positive as a case. So my model does look at that, and the most recent estimate was about 39% of Oregon had either been infected and vaccinated or infected. And so that, you know, probably quite a bit higher than you would imagine with just looking at case counts. And that's because we know that, you know, there's a lot of asymptomatic disease, and so those folks might not ever get tested. And then there's people who just don't access it anyway. And so, you know, in the current, for Omicron, we're expecting a big wave of infections again, because it does move through the vaccinated population as well. And so, you know, even if people aren't getting tested, my models is building in the idea of how many infections there are going on that are generating the hospitalizations we see. That's kind of the main signal that the model works with, is how many people are showing up at the hospital. We know that some number of infections are going to generate that. And so, you know, right now, I think I have an estimate of around 4% of the state may already have Omicron right now. And that's going to grow through January. So, you know, I would, you know, you can see the percentage of the population that could get it could grow very fast.
Thank you, Dr. Graven. This is Dean Seidlinger. I'll just add a little bit. You know, we do know that the numbers that we report daily are an undercount of the actual infections that are out there. You know, early on during this pandemic, when there was less disease, we estimated we were picking up, you know, between 50 and 70% of infections at time. That certainly drops down as cases surge, particularly with the large number of folks without symptoms or with mild symptoms that they don't ascribe to COVID who don't get tested. I agree with the statements you heard about, you know, individuals who are vaccinated and who are taking precautions against this disease are also the people who are likely to seek care and testing for mild illness. People have in Oregon overall have consistently been taking precautions to protect themselves and those around them. They've stayed home, they've worn masks, they've limited gatherings, postponed holiday events and celebrations. They got vaccinated when vaccines were available. They brought their children in to get vaccinated. They've received booster shots when eligible, and they're heeding the advice now to stay home more often, to avoid crowded situations, and to wear their masks when they're out. Those same individuals who are taking those precautions are also the individuals who are likely following the advice to seek testing when they have mild symptoms or to seek testing when they are exposed. So it's not that surprising that we may be seeing higher cases in some of those highly vaccinated communities. Those highly vaccinated communities also tend to have denser populations where this virus, which is incredibly transmissible, is going to spread even more rapidly. This virus is throughout Oregon, and if you're not taking these precautions, you will be impacted yourself, your family members, your favorite business that you need to go to, your child's school or daycare, or your workplace. So take precautions for the next several weeks. We can get through this together.
So I didn't hear a number in there. What number of Oregonians are we expecting to get it during this wave? What percentage?
I don't have a specific number. I think know that we are going to see our case counts continue to increase. Those case counts remain an incredible underestimate of the true burden of disease, but we can expect, tens of thousands of Oregonians in the coming weeks to be to test positive with COVID, and that again just represents the tip of the iceberg of what we're going to see. And
Peter, do you have a number or a rough estimate?
Yeah, that's not a specific number I usually kind of calibrate around, but the reality is, we're saying that about my model does say about 65% of people no longer have immunity, and therefore, from previous infection or from vaccine, and so therefore, for this to slow down, we do think about those herd immunity effects, which is for the infections to stop happening, that chunk of people is going to have to get infected or get boosted where their immunity is strong enough to prevent the infection. So, it could easily be a majority of Oregon would be reinfected with or get infected with this. But like I said, I'm not going to, those aren't numbers that I have here in front of me or anything, but happy to circle back at some point.
Thank you, Rachel. Okay, and hopefully everybody is looking at the chat. There's been some information posted based on questions, so thank you so much for providing those. Also, a note from Genevieve with K2, letting people know how to raise their hand if they have a question. So again, find that mute button, keep muting yourself when you're not on. Thank you very much. Our next question, Elizabeth Miller, OPB, go ahead. Elizabeth?
Sorry, weird mic setting. Thank you, Erica.
You bet.
I had a question for Colt. So it seems like, at least with these 3 schools that have closed in the Portland area due to are due to staffing issues and absences, kind of more of a logistical problem. I mean, what's ODE's role in keeping those staffing issues and absences from closing schools, and are there any is there any guidance ODE is working on around asking students and families to have stronger masks or better masks as opposed to the cloth masks? Thank you.
Yeah, again, I'll turn back to Dr. Seidlinger on the mask question. I think that the way that he answered that shows that cloth masks and other kinds of masks can be effective tools. It's about the fit and about the quality of the mask. So we can have him circle back to that after I answer. Right now in Oregon, nearly all school operation decisions are local decisions. So the Department of Education, I'll drop it into the chat here in a minute, has a continuity of services website that has a number of tools that local school districts can use, to review their local COVID statistics, their educational statistics, understand the community that they're serving, and then some decision guides and equity guides to help them make decisions around when it makes the most sense to continue to operate in person or when they may need to temporarily shift to short-term distance learning, and a planning guide for that as well. So we provided our districts with the tools to use to make these decisions. and to follow through. These tools, like you've seen with these schools that have closed so far, also help schools plan for delivery of food, making sure that the students have internet access so that they can access the online instruction when it occurs. So a number of those pieces are in place. As far as preventing it in the first place, that really comes down to the number of staff members that are exposed. And if it's a school exposure in that structured setting where all the layered health mitigation protocols are in place, it is very likely that Omicron or the COVID-19 won't actually be contracted by the individual who became in close contact with someone. And we have the test to stay policy and tests available in schools for school staff and students so that they can continue to work through that as long as they're not symptomatic. The outside of school close contacts and contractions of COVID-19, those will be the place where schools operations will be threatened. So anything we can do in our communities to get, again, more people vaccinated, more people boosted, more people properly wearing face coverings and reducing community spread will help not only schools, but it will help our hospitals and our other workforces for all business and industry in Oregon to maintain operations.
Thank you for that question. Okay, our next question comes from Pat Doris with KGW. Go ahead, Pat.
Thank you. I have a question on the triage guidance, which I find quite striking. I'm wondering, has this ever been issued in Oregon before? Part one. And part two is, and do you really think it's going to get that bad?
Thanks, Pat, for your question. This crisis care tool that we issued today has been something that we have been considering and exploring for the last 2 years over this pandemic. As you may know, other states have issued similar tools to assist hospitals and healthcare providers in making these types of difficult decisions if they were faced by it. We, a year ago, articulated a set of principles around equity and supporting individuals in this situation that has outlined this tool. We really built this tool based on learning through this pandemic, learning what other states have done, and really building from that place to make sure we can have a tool, should it be necessary, that is really focused on ensuring considerations for individuals with disabilities and focusing on equity. So we certainly are hoping that these types of decisions are not needed. We'll continue to work very closely with our hospitals around staffing and other resources and collaboration and communication, but we wanted to be sure to equip our hospitals and healthcare partners with such a tool should these decisions be needed.
And I guess just as a brief follow-up, what about for you to even put this out? Isn't it chilling to think that we might really be at a place where the hospitals are so overwhelmed in just a few weeks that people are making life and death decisions?
Absolutely. This is a very difficult topic to consider and to work on. As a practicing pediatrician, and I know among all other healthcare providers, our goal is to do everything we can to take care of patients in the best way possible. With the rise of Omicron in front of us, we recognize there could be a future point that the resources we need to do this are limited. We certainly hope this doesn't come to bear, but we want to make sure that we had a tool that could be of assistance to others to make these types of decisions in a way that is fair, non-discriminatory, and focused on equity.
Okay, thank you.
Thank you both. Okay, our next question comes from Gary Warner with EO Media. Go ahead, Gary, and thanks for your patience.
Sorry there. I wanted to ask Dr. about his latest forecast, which basically is a really high spike with a quick drop down. So we're looking at a spike of about 1,650 around January 27th, and then being back down to looks like, you know, 0, at least on the chart, by early March. We saw a similar model at the beginning of Delta, and instead of that big spike, it ended up looking more like the Rock of Gibraltar, basically up high and then a slow way down. How sure are you that this thing is basically going to be burned through by that point? And what factors would extend that significantly, like it was with Delta, where they started out saying early October and we ended up in December?
Yeah, Gary, you're right. The reality is I'm much more confident about the increase in the period that's close to us here, and I do expect that tail will extend. In fact, you know, I think that's what we're hoping, is that we're going to flatten the curve and extend that tail. So I think your observation is right. You know, until we see exactly how this is spreading, it's hard for me to kind of calibrate that tail point. And I would expect that to be revised upwards in future weeks as we kind of see more about how this is going. The key, you know, obviously what I'm trying to do is to show that, you know, yes, we're seeing a surge. It's starting now. The timing is now. It looks really big, bigger than Delta. And those are the things that I can say with more certainty. But yeah, I think you're right. The downslope, we'll find out more about that.
As a quick follow-up on that, there's reports yesterday that the CDC and the Biden administration are looking at remodeling sort of the approach to get people used to the idea that this is something that's just going to have wave after wave after wave, and we're going to have to learn to live with it. When I look at your charts, it seems like, you know, we're zeroing out that there's an endpoint. Can you line those two things up?
Yeah, well, I think, you know, hospitalizations are different than infections. So I think, you know, in the endemic state, it's true that the infections are going to continue to roll through the population in probably a seasonal fashion. Hospitalizations, however, those we would expect those to be to slowly decline because as every exposure you get to either the vaccine or the virus is going to improve your ability to avoid hospitalization. So I don't think we're going to have waves of hospitalizations that are going to be similar in scale at all to what we see with infections. Of course, we all know flu it provides hospitalizations every year. You know, perhaps it'll be more mild than that. We have a pretty effective vaccine against it. But I think the reality is, while infections are likely to be continuing to go through as waves, the hospitalizations I wouldn't expect to follow the same pattern.
Thank you very much.
Thank you, Gary, for your question. Our next question is from Lynn Terry with Oregon Capital Chronicle. Go ahead, Lynn.
Thanks, Erica. I have two questions, actually. One, and forgive me for belaboring this, but can you go over the isolation recommendations? If you're masked and you're in a room and someone later turns out to have been infected, should you isolate? Do you wait till you test, although you've already been spreading it? What exactly is the recommendation and for how long? And then I have another question about the crisis of care standards.
Thank you, Lynn. The new guidance for the general population in most settings is that folks who are ill with COVID, who've tested positive, have symptoms and have had an exposure, would isolate for 5 days. If they don't have any symptoms at all, or if they have symptoms that are resolving and their fever has gone away, they would stay home for 5 days after they were diagnosed. And then on day 6, they would be allowed to leave their home, resume some of their other activities if they can wear a mask in all of those settings for day 6 through 10. For quarantine, or asking people to stay home after they've been exposed, adults who are fully vaccinated and boosted would continue not to have to stay home. We would not recommend that they stay home after an exposure. But if they develop symptoms, we would ask that then they stay home, get tested. If that test is positive, that they isolate for 5 days. For folks who are not up to date with recommended vaccine doses and they have an exposure to someone with COVID-19, we would ask that they stay home for 5 days. that they get a test as close to day 5 as possible. And if that test is negative, that they can then leave their home on day 6, wear a mask around when they're around other people for days 6 through 10, and as long as possible. If they test positive, then they would stay home for 5 days following their test so that they can recover and not infect others during their illness.